What is fatty liver? Mention any two lipotrophic factors. What is fatty liver? Mention any two lipotrophic factors. Very simple question, 3 marks question. Fatty liver is a condition characterized by accumulation of fat, that is triglycerides, in the liver. So you can see here, this is the healthy liver. This is the normal looking histology of the liver. What you can see here, this is the unhealthy liver known as fatty liver. What you can see here, white droplets. So these are nothing but fat globules. So fatty liver either can be alcoholic liver disease, or it is due to non-alcoholic liver disease. Okay, non-alcoholic like metabolic syndrome, like diabetes mellitus, obesity, certain drugs that can lead to fatty liver. Next, the question is, what is lipotrophic factors? Lipotrophic factors are those which causes breakdown of the fat or which helps in clearance of fat from the liver. So what are lipotrophic factors? The main lipotrophic factors, one is choline, betaine, methionine, and others. Let's see, if they ask you in exam 3 marks, you need to write point wise answer. One is the choline. The choline decreases oxidation of fatty acids, decrease phospholipid synthesis. Then the betaine, methionine, which is a powerful lipotrophic factors. Then essential fatty acids, like example linoleic acid, linolenic acid, and arachidonic acid. Then inositol. What are essential fatty acids? That can be asked. One is linoleic acid, linolenic acid, then arachidonic acid. Okay. Yes. So when there is absence of lipotrophic factors or any abnormality, that leads to fatty liver. Fatty liver leads to cirrhosis. Cirrhosis leads to ascites, jaundice, and the liver failure. So what you can see here, there is a picture. There is something known as quinoa, which is very rich in lipotrophic factor. Okay, this is quinoa, which is given in your notes. Look at this patient. This patient, you can see here, this patient is having ascites, and also patient is having pitting edema. This patient suffering from alcoholic liver disease. So because of alcoholic liver disease, there is a fatty liver. Then there is a cirrhosis of the liver, hepatic failure. So what you can see here, this is the ascites. So clearly visible ascites that you can see here. And also what you can see here over the limbs, pitting edema. You can see the pitting edema, and also you can see the pitting edema here. Pitting edema. Okay. So this is pitting edema. And also you can see here the jaundice. The patient is also having jaundice. Jaundice can be asked in the 3 marks question. What are the causes for jaundice? What is pre-hepatic, hepatic, and post-hepatic jaundice? So that is very commonly asked question in your exam. So this is pitting edema. So this is some applied biochemistry related to the question. Look at the eyes of the patient. Patient is having jaundice. What you can see here, can you make out? So this is jaundice due to fatty liver or due to cirrhosis of the liver. Next question, mention the biological reference interval for serum sodium. Write any three biochemical functions of sodium. List two causes for hyponatremia. See, the sodium is a basically extracellular cation. So normal level is 135 to 145 milli equivalents per liter. So this should be your answer. Okay. And around there is 92 gram of sodium in our body, 50% represent in the ECF. What are the functions of sodium? So the functions of sodium, the one very important function, as you know, action potential. Action potential, you need to mention three important functions. Second, it maintains acid-base balance. Acid-base balance. It also responsible for osmolarity of the extracellular fluid. For muscle contraction, you need sodium. So sodium has many functions. What is hyponatremia? What are the causes? You need to mention at least two causes here. Hyponatremia, it is classified into hypovolemic hyponatremia, euvolemic hyponatremia, and hypervolemic hyponatremia. What are hypovolemic hyponatremia? Causes are dehydration, diarrhea, and vomiting. Euvolemic example, syndrome of inappropriate secretion of antidiuretic hormone, hypothyroidism, psychogenic polydipsia, adrenocorticotropin deficiency, all this leads to euvolemic hyponatremia. Sometimes there can be hypervolemic hyponatremia either due to heart failure, liver disease, nephrotic syndrome, advanced kidney disease. So this is very important question. Hypokalemia, hyponatremia, and hypocalcemia, all these are commonly as topic in your exam. Look at this. So this is the classical patient suffering from nephrotic syndrome. Nephrotic syndrome can lead to hyponatremia, that is hypervolemic hyponatremia. Next question. Component of oral rehydration solution, ORS solution. What is the purpose of adding glucose in ORS? See, the ORS, now look at this ORS formula, new formula of WHO ORS. NaCl is present, that is sodium is present around 2.6 gram. In terms of milliequivalents, millimoles, it is 75. Potassium 1.5. Trisodium citrate 2.9 gram. That chloride level, that is 65. Glucose 13.5, highest concentration. Water is around 1 liter. So total osmolarity is 245. Why this sodium is added along with the glucose? Dear student, remember when you add glucose, so along with the glucose, sodium is also absorbed. What is that known as? Secondary active transport. Look at this. So there are two types of transport: primary active transport, secondary active transport. So primary active transport, so where there is a involvement of the sodium and potassium, so that involving ATP. Secondary active transport, sodium goes in along with the glucose. So this can be asked in your exam. So this is briefly about the question number 13. Question number 14. Mention any three site-specific inhibitors of electron transport chain. Electron transport chain, very important topic. How many complexes are there? 5 complexes. 1, 2, 3, 4 and 5. 5 is known as ATP synthase. So what is complex 1 inhibitor? So complex 1 inhibitor, one example is rotenone. You can remember rotenone A. So A means that is alphabet 1. That means it is complex 1. Complex 2, carboxyl. Complex 3, antimycin A. Complex 4, cyanide, azide and carbon monoxide. So rotenone complex 1, carboxyl complex 2, antimycin A, BAL also. One more, that is BAL, British anti-lewisite. 3 alphabets are there, that is the complex 3. Next, look at the one more picture here. Inhibitors of electron transport chain. You can see here chlorpromazine, rotenone, amobarbital, pyridine A. All these are complex 1 inhibitors. Complex 2, carboxyl and malonate. Complex 3, that is BAL, antimycin, naphthoquinolone. Complex 4, carbon monoxide, cyanide, azide, hydrogen sulfide. Dear students, can identify this. A patient who is suffering from certain disease or certain some air, some poisoning, and patient died. On examination, patient is having cherry red postmortem hypostasis. What is this? So this is classical carbon monoxide poison. Carbon monoxide inhibits complex 4 of electron transport chain. Next, name enzyme defect in von Gierke disease. Glycogen storage disorders, very commonly asked in your exam. What is the enzyme defect in von Gierke disease? Very simple, glucose 6 phosphatase. When glucose 6 phosphatase enzyme is absent, there is no conversion of glucose 6 phosphate into glucose. So there will be no glucose. So the glucose 6 phosphate enters into other pathways that leads to multiple complications. Let's see what are the glycogen storage diseases. One is von Gierke disease, that is type 1. Enzyme deficiency, that is the glucose 6 phosphatase. What are the biochemical abnormalities? Severe hypoglycemia, lactic acidosis, hepatomegaly, hyperlipidemia, hyperuricemia and short stature. So all these are the biochemical abnormalities. If you mention these 3 points, you will get 3 out of 3. Then Pompe disease, that can be asked in upcoming exam. Cori disease, Cori debranching enzyme. Anderson AB mnemonic branching enzyme. McArdle's myophosphorylase. So all these are the that is glycogen storage disorders you must know. So let me complete, because this is a short session, 3 marks question. I need to complete most of the topics in 30 minutes. Look at this. This is the classical von Gierke disease. The patient will be having hypoglycemia, doll-like face, seizures, coma, intellectual disability, glycogen accumulation, hepatomegaly, distended abdomen. Question number 16. What is pellagra? Write the clinical manifestation of pellagra. What is pellagra? Pellagra is because of vitamin B3 deficiency. What is vitamin B3? Vitamin B3, niacin deficiency. So niacin deficiency characterized by 3 Ds, sometimes 4D also. What is 1D? D for dementia, D for dermatitis, D for diarrhea, D for death. One classical appearance in pellagra. So this is the classical appearance. Here a male who is suffering from vitamin B3 deficiency. So patient is having some dermatitis around the neck. look like a necklace. This is known as castle necklace appearance. Okay, that is about question number 16. And vitamin B3, niacin, synthesized from essential amino acid tryptophan. A diabetic patient was advised not to take polished rice but to take brown rice. Explain the reasons for the same. So the patient is diabetic. You must be knowing diabetes. So there is a high blood glucose level. When there is a high blood glucose level, so it can lead to three important complications. It can lead to nephropathy, it can lead to neuropathy, it can lead to retinopathy. Okay, there can be blindness, there can be kidney failure, there can be stroke also, there can be heart attack also. So all these are the complications of diabetic high glucose level. So that's why diabetic patient should take some food which has low glycemic index. So this brown rice, so this is the brown rice. The brown rice has less glycemic index. It has a less glycemic index. So because of this phenomena, low glycemic index, there won't be sudden rise in glucose level. So the aim is to maintain normal glucose level. For that purpose, you should take low glycemic food. Example is brown rice. Now look at this very interesting picture. The white rice glycemic index is 92. 92. 92. Donut 86. Wheat bread 64. Mango 60. Banana 52. Like that. So it's all based on the glycemic index. That's why. That completes question number 17. Question number 18. Mention 3 homopolysaccharides. Write their biological importance. So there are certain homopolysaccharide. What do you mean by homopolysaccharide? Homo means they are made up of same monomer, like example glucose or fructose. So here three homopolysaccharide of glucose. One is cellulose, starch, and glycogen. So what is this cellulose? Cellulose is beta glucose. Bond is 1,4. No branches. Starch is having two components, amylose and amylopectin. It has 1,4 and 1,6 both the bond. It is nothing but alpha glucose. Amylose no branching. Amylopectin has branches. Glycogen, it's an animal storage form of glucose. Alpha glucose, it has 1,4 and 1,6. Okay. So remember the basic function of all the three. So usually glycogen and starch, so they are storage energy. Okay, they are storage form of the glucose. So whenever there is a hypoglycemia, whenever there is a starvation, so these undergo glycogenolysis, so that can meet the demand of the body. Okay, so they are nothing but energy store. Cellulose, remember, this is a dietary fiber. Dietary fiber which are very important in preventing certain diseases like bowel cancer also. So that completes the question number 18. If you mention 3 points, more than enough. Next, question number 19. Write the bicomical defect in Ehlers-Danlos syndrome and osteogenesis imperfecta. So here in the picture, what you can see here, a male who is having hyperelasticity. What is having? He is having hyperelasticity. He is having hypermobility. So and also he is having recurrent joint dislocations. So there can be SAH also, subarachnoid hemorrhage. So this is classical Ehlers-Danlos syndrome. In Ehlers-Danlos syndrome, there is a problem in collagen synthesis. So due to genetic mutations, so it can be classical. So many types are there, classical type and other types. Basically, it affects the collagen synthesis. You can see here this picture, very interesting picture. The patient is having joint hypermobility, usually hip dislocation or shoulder dislocation, recurrent dislocation. Okay, classic type where there is a defect of collagen number 5. So that is collagen defect type 5. So vascular also, vascular Ehlers-Danlos syndrome where there is a type 3 collagen defect. It can affect the blood vessels also. It can lead to Barré aneurysm also. So there are so many complications in Danlos syndrome. Then one more question asked, osteogenesis imperfecta. In osteogenesis imperfecta, you will see hearing loss. You will get blue sclera and also multiple fractures. So multiple fractures. So in osteogenesis imperfecta also there is a defect of collagen 1. Collagen 1, it is also known as brittle bone disease. Brittle bone disease. So that completes the question number 19. Last question. Write the bicomical cause of respiratory distress syndrome in premature babies. In the picture, what you can see here, there is a premature baby. So in premature baby, what happens actually? Premature baby. So there is a no maturation of type 2 pneumocytes. What is the function of type 2 pneumocytes? The function of type 2 pneumocytes is synthesis of surfactant. So there is no surfactant. When there is no surfactant, there can be increased surface tension. This leads to collapse of the alveoli. So when there is a collapse of alveoli, patient will be having signs and symptoms of lung disease. What are the lung diseases here? Tachypnea, patient will be having more respiratory rate, patient will be having cyanosis, nasal flaring, grunting, apnea, dyspnea, chest wall recession, suprasternal, intercostal, subcostal recession are common. So this is also known as hyaline membrane disease. Hyaline membrane disease, HMD. Hyaline membrane disease. So it can be seen in adults also, that is known as adult respiratory distress syndrome. One of the causes is the COVID-19 infection. So but in children, in premature baby, this is the pathophysiology and these are all the signs and symptoms. So this completes the short answers of Feb 2023 paper 1, and discussion is very short and brief. It is basically to target your RGHS exam. Thank you. Good night.